Hi, Facebook world. If you can hear us, please type in the chat box or in the Facebook comments. Please share with us where you are joining us from today and your class year from VCU. Alumni, we want to know when you graduated, where you're working, and students, we want to hear from you. When do you plan to graduate and what are your career aspirations? We also have faculty and staff here with us today, so please share that if that applies to you. And we warmly welcome families of current students today as well. So if you are a parent or family member of a current RAM, please share that in the comment section. Thank you for joining us today for a webinar with VCU alumni called Leading Through Extended Upheaval, a Q&A with alumni hospital CEOs on leadership in 2020. My name is Dr. Amy Gray-Beck. I'm the Executive Director for Alumni Relations at VCU and a proud alumna of the VCU School of Education from 2019. We will be recording this portion of the webinar and captioning it and sharing it on our YouTube channel for later viewing. You can catch all of our previous virtual programs and Q&As on the VCU Alumni YouTube channel. Now, to get started, I'd like to introduce our moderator slash panelist this afternoon. He's doing it all, Alan Cassie. Alan is the Chief Executive Officer of HCA North Florida Division's Capital Regional Medical Center. Alan.
Well, thank you, Amy, for this opportunity and for organizing this great event. And I'm excited today to introduce one of our esteemed alumni from 1968 from the Health Administration Program, one of the first classes there. 52 years ago, he was at the MCV back in the day, now great VCU program, Mr. Osteen. So he's here in my office as a cameo just to say hi, and excited to have him with us today. I also
looking forward to it.
Thank you. I also want to welcome Dr. Paula Song, who's on the call. She's the new chair of the VCU Department of Health Administration. We look forward to working with her and under her leadership, and very excited for Dr. Song to be here. A big thanks to the American College of Healthcare Executives as well for sponsoring this event and giving us all credit, which we all need to renew our fellows this year. So we appreciate that as well. I'm honored to be here with Roberta, who I graduated with back in 2009, and Colleen as well. Great colleagues of mine and representation of the great program that we all hold dear in our hearts. So we're going to go through these questions pretty quick and just open up some real dialogue around COVID-19. It's a subject that's all dear to our hearts, and we all are still living through it. As we know, folks have been impacted personally, on this webinar more than likely, and it's an ongoing opportunity for us all to care for our community. So just want to acknowledge that and then reflect back on the last 8-9 months and the experiences that our hospitals have had, and look forward to getting some insights and also looking forward to how we can all move forward. So first question is for Roberta. I'm going to pick on her first. So Roberta, all of our organizations, hospitals have morphed, the last 8 or 9 months, and how we've handled COVID-19. So maybe just reflect back with your own organization, and how did you all change, from March to now? I mean, what things have you faced and how have you changed?
Certainly. Well, previous to the pandemic hitting, our organization was already in a transformation, and we were doing well and decided to change our entire operating model and organize ourselves in service lines according to clinical preferences, cardiology, neurology sciences, etc. The pandemic for us actually accelerated that transformation, because then we had to accelerate how we worked as a matrix organization. We had to identify how we worked at cross purposes across organizations, sites of care, ambulatory clinics, emergency departments, and pivot very quickly. And so what we found is that as we continue to focus on what was the best thing for the patient, what was the best thing for the caregivers in times of uncertainty, the more we focused on that, and the more easily we were able to pivot and have one or two things we were keeping our attention on and kind of reducing all the other noise. And so that has helped us to move through that, and actually has been a catalyst for additional transformation, even though we're not in the height of the pandemic.
That's great. And Roberta, maybe, what was some of the things that you were afraid of, back in March, and that maybe you're not afraid of now, as your organization has catalyzed and kind of changed and more?
Certainly. The thing that many hospital organizations feared was, how do we protect our staff against the uncertainty? And for many who may know me, but I was actually on maternity leave at the exact time we were at the height of the pandemic. And so I was leading from afar. But what I'm no longer afraid of is, do I have the right team in place? Absolutely. Does our organization have a current and proactive future looking plan to manage the uncertainty of PPE? Yes, we do 100%. And it's nice to know that that's not an additional level of concern we have, because we're constantly preparing based on what we learned in the last few months.
That's great. No, it's good to hear. And hopefully little one's doing well at home.
Yes.
So, Mr. Tench, who's a great guy. Colleen, for you, pivoting over, when we look at all the different things as hospital administrators you've had to live through, over the years, different crises, different events, how would you contrast and compare, the current COVID-19 pandemic with something else that you've maybe had to lead through in your career in the past?
So first of all, this was really created a state of panic, I think, to start, because it was so unknown. It created uncertainty, and some of the initial projections using like the CHIME model, for example, showed some of us that we were to anticipate 4 times the volume than the size of our facility. And a lot of us were looking at stadiums and et cetera to create hospitals. And so the sheer panic in the beginning of the entire world, it seemed, heightened the emergency management. And you really couldn't take traditional emergency management. And I've lived through a shooting in the ED and, a prison outbreak and, things like that before. But this is different because it's really needed a long-term response. So you had to reformat or restructure how you looked at emergency management and make sure that it was sustainable over time. You couldn't have your teams in an incident command center all day with the same leader. So you really had to trust and learn how to rotate. I was also new to the organization. I'd only been there a couple months before the pandemic hit. So we did a lot of storming and norming very quickly and got to know each other and our skills and our talents and our strengths. So we really had to form more of a long range strategic thoughtfulness and then to operationalize really quickly. And then it moved into more of continuous improvement, getting preoccupied with failure and trying to poke holes in all the different things that you could think of. But things were changing so frequently, like the CDC was sending messages that were more than daily sometimes, and sometimes very contrasting. So I think it was very different because it wasn't a singular instance that was a couple hours or a couple days. We've been living through this since March.
Yeah, no, that's a great reflection. It's less an acute event, but more of a sustained response. And kind of just curious on one of the responses that you all had. Maybe you can both reflect on this, starting with Roberta. How did you deal with families and that wanted to see their loved ones that were admitted? I know that's always a challenge when you're trying to protect from an infectious disease, impacting your staff, the physicians, the community. So how did you all creatively deal with that? I know it's something we struggle with.
Certainly. We took a system approach of figuring out how we could connect with our families that weren't able to come into the hospital. And through the enormous and amazing support of our Inova Healthcare Foundation, we had so many generous donors who actually donated iPads that we didn't have in place before, that we could designate into these patient rooms that were not used for any other function. And so they had their own communication mechanism with their family members. And actually, there was moments where we would write notes on the glass windows, and that helped the team communicate well with each other as well as the patient. There's pictures of, if family couldn't come in, how do we become that patient's second family? Because we're the person that's communicating with them. And I love seeing the pictures of like tic-tac-toe, right, on the glass, because that's an opportunity for that person to have some sense of normalcy in the midst of it all.
That's great. Colleen, any comments on that?
With patients and families, same thing. I think leveraging technology was huge. So we did the iPads, the FaceTime, and it was more important than ever because we did limit visitors for a period of time that we knew we had to increase communication. And we also took the extra steps, especially if people were at end of life and they couldn't have anyone at their bedside besides the nurses, and putting butterflies in the windows so that their family can see from the outside, where they physically were located. It just produced so much emotion, and you were constantly reminded of why we had chosen this role, and it really brought things into perspective.
That's great reflection. I like the butterfly thing. That's something I think I'm going to go back and adopt today. That's great to hear. When you think about your teams and the emotional toll that it's taken on families and patients, but it's also a very high emotional toll with uncertainty for our teams. So how have you seen and kind of worked with building up morale, whether it's amongst those direct frontline caregivers, the uncertainty of folks that might have reduced hours for a certain period, or physicians whose livelihoods and whose businesses are small businesses for the most part? How have you increased morale and work to kind of sustain that with your team? And Colleen, maybe start with you on this one.
I think this was one of the, like Roberta had mentioned, one of the most important roles that we have as leaders, as well as presidents, CEOs of our organization, is to have that top of mind. We knew that we had limited staff and probably more patients than any of us could possibly handle in the beginning, when we were unclear how much volume we would get in. So it was really about keeping the morale up as much as possible. And I think as leaders, we can do that face-to-face as much as we can, also through clear and transparent and frequent communication. And so we opened the lines of communication far more than we had before. So they were getting daily messages from me, as well as way more rounding than usual. Leaders were kept abreast of information frequently, multiple times throughout the day. So I think leaning hard in communication and interaction, and reminding ourselves of the personal touch and the anxiety that we have, not only at work, but how that translates to our families. It was a huge change for everyone at home as well. And so keeping that at the top of our minds, and it just created such an emotion. So you really have to pull and try as many things as possible, and fail forward fast was one of our mottos. So pick something, try it, and if it doesn't work, find something else. Mm-hmm.
Roberta, how about you?
Yeah, what I would add on to that is ensuring that your leadership, the ones that sit at the table with us making those decisions, that they first and foremost are able to understand what's happening and model that change, right? So it's so easy when we go into a disaster mode that we go at highest capacity for 24, 48, 72 hours to get through that acute event. But now we're day 2, day 10, day 22. You're now 3 months into it and you're not actually sure what's happening tomorrow, or will next week be a little bit lighter? Will it be worse? And trying to, as Colleen said, navigate through different and ever-changing CDC guidelines. And so it's always a moment of looking to your left and looking to your right to say, are you okay? Mm-hmm. Are you getting enough balance? Are we helping you out? We all can't do the same thing at the same time, and let you go to that meeting, I go to that meeting. And then if we figure out that balance, then translating that down to our teams and doing exactly what Colleen said: frequent communication, frequent touch bases, and really asking about the basics. It's safety. Do you feel safe at work? And what can I tell you? What can I find out for you to help you feel safe? And we didn't have all the answers, but it's okay to say, I don't know. Let me find out, and committing to coming back and saying, this is what I know. This is what's in planning. This is what's in future planning.
Yeah, I found myself even, reflecting on both what you said. I mean, one, take care of myself, months in, I felt that was crucial to keep up the momentum. And then we did town halls, nights, weekends, had call-in numbers. I heard a great example the other day. Somebody put up a whiteboard by the entrance and just wrote, what's going on today, because the information changed so frequently. I think filling that gap of uncertainty was really essential. But I do remember early on, I was going home, taking off my clothes outside, taking a shower. I mean, there's just a lot of uncertainty about this virus that, affected all of our lives personally, and then as healthcare leaders. But hopefully we could lead our teams through it. So talking about leadership and what, you're both exceptional leaders in your organizations, and I'm honored to be on this panel with you. And, when you reflect all the way back to Roberta for us, gosh, 13, 14 years ago now, something like that, maybe 15 years. I remember my first daughter was born when we were there at school. And Colleen, for you as well, like reflecting back on the program, what classes, looking back at your tenure at VCU, how did your time at VCU prepare you, for your role now and what you're doing to lead your teams? And maybe Roberta, start with you.
The first memory that comes to mind when you talk about that is the rotation we did where we spent 24 hours with a physician and we had to spend 12 hours with a nurse, right? Because in that moment, we had to see what our caregivers were seeing frontline. And it set the stage as we went to our residencies, where we were expected to not just be the administrator in the boardroom, assigned to or linked with the executive team, but we were hands-on, working with staff, asking questions. How does this impact you? Tell me about this. And that expectation of us when we were students, I think, has set the foundation for us to be inquisitive, engaged, frontline leaders going forward.
Great. Colleen, how about you?
Yeah, I agree. As soon as Roberta said that, I had a flashback. I went to the VA and I saw an amputation, and it's just all vividly came back to me. But really, like she said, and that's what I love about the health administration program being in a new building, so that they can interact with various students. It was the exposure to others, really, because we're leading a building of a lot of different personalities and different skill levels, but the more exposure you have to different perspectives is incredibly important. And so the program provides that for you. I also love the practical exercises of operational problem solving or some of the strategic thought processes to really create critical thinking, and some of the debates that we had in class to help understand perspective, because we're here, we don't always know all the answers. Even surprise, surprise, getting to this role, running an organization of your own, we don't know all the answers, but really leaning on the talent and skills of others and showing appreciation and value to the people that you're working with, you'll come up with great answers together. And so that's something that you also learn in the teamwork exercises at school as well.
Yeah, I think it was an excellent program. I think prepared us all. And speaking of debates, Roberta and I debated all the time, but somehow we stayed in touch. But no, we had a great. I think that's the point. Is I have a cohort of students, faculty who I can still call on with VCU to encourage us, tell us, connect us to the latest research, and then also just to bounce ideas off of. I think in a time like this with COVID-19 and the pandemic, I can pick up the phone and we can call each other, learn from each other, and just have someone to listen to us as we, deal with our own emotions through this, pandemic time. So I think it's a great network and family. And then, I'm going to leave the last word to Mr. Osteen here. 52 years ago, graduating from Medical College of Virginia. Any questions for the panelists, Mr. Osteen?
I was primarily a small hospital guy during my regular working, and it just scares the death out of me whenever I get up every morning and listen to what the report is about whether all your beds are filled or you don't have the equipment there. And so that to me says, my little sweating wasn't near what you guys are going through. So congratulations on making it easy on the families as well as on your employees.
No, thank you, Mr. Osteen. So, I think that's one thing we take to heart, all of us, Roberta and Colleen, is that we're here for our communities, regardless if it's a shooting, if it's pandemic, or just a normal day. I think we're here to care for folks. So Amy, I think that's kind of wrapping up on our end, and keep going if there's any questions, maybe in the comments or.
I think everyone's in awe. So yeah, no questions, but thank you everyone for tuning in. So students and alumni who are on the webinar right now, please stay on for an exclusive networking event that will happen. But everyone on Facebook Live, it was a pleasure seeing you today. Thank you to each of our expert panelists, Roberta, Alan, and Colleen, VCU alumni, students, faculty, staff, and family members of current staff. Family members of current students appreciate your expertise and experience you bring to this topic. Your time is incredibly valuable, as we know, and recognize this is obviously a very busy time for you. We're so grateful for the work that you do and the awareness that we can build, and we want to thank you for serving on this panel today. We will be reposting this webinar to Facebook and YouTube with closed captioning for later viewing. If you've enjoyed listening and learning from our Health Administration Department, please consider supporting the department with a gift. The Health Administration Department relies on the generosity of its alumni and from our community to support its teaching mission, research, and offering great learning opportunities like the one you enjoyed today. So to give, please visit www.support.vcu.edu/give/health-admin. Thanks again to our panelists, Alan, Roberta, and Colleen, and we will see you soon. Go Rams. Thank you. We are closing off for Facebook Live, but please, if you are on the webinar, please stay on because we are going to have an exclusive networking event.